Dr. Morris, I hit record, so whenever you're ready to begin.
All right. Can you hear me all right?
Yep.
Okay, thanks. I'm paranoid about technical difficulties now. Okay. Let's see. So you should be able to see my PowerPoint. Oops. Oh, hold on. Hold on. Oh, geez, oh, Pete. I don't understand why I can't do this anymore. Okay. So now you should be able to see my PowerPoint. And I'll just skip right ahead. Speak up if you can't see it because I can't see the chat box. So just go ahead and unmute yourself and holler if for some reason you can't see that. So the CDC did make some recommendations for those that are fully vaccinated. If everybody could make sure that they're muted on their phone and their computer, that'd be great. So I put the website here. I did not put on here what fully vaccinated means. Fully vaccinated means that you are at least 2 weeks past your last dose of your series. So if it's 2 doses, as in Moderna and Pfizer, you're 2 weeks past your second dose. If it's the Johnson & Johnson vaccine or a 1-dose series, you're 2 weeks past your only dose. So that's the definition of fully vaccinated. So if you're fully vaccinated, you still need to take the normal precautions when you're in public. You also should take precautions if you're visiting people who have risks for severe COVID, so those who have comorbidities, or if you're living with someone like that, or if you're visiting unvaccinated people who are from multiple different households. You should still avoid medium and large sized gatherings, whether or not people are vaccinated. You should still get tested and still isolate if you have symptoms of COVID. I've gotten this question several times. Even if you're vaccinated, same as even if you've been infected in the past, you can still get infected. It's just much less common. However, if you have symptoms, you still need to do the same thing. You need to stay home and get tested. There's particular concern with the new variants going around that we might see breakthrough cases. So again, same thing if there's symptoms, you do the same thing. You still need to follow guidance that might be out there by your employers. And so remember the epidemic orders and our MIOSHA codes and everything still require mask wearing in buildings, in public places, in stores, and in schools, regardless of vaccination status. There likely will be some adjustments to some of the like residential gatherings and things to take into account vaccination status, but just remember that that all still applies. You still must wear masks in schools and in buildings and in public based on the epidemic order, but also it's still recommended when you're in public because again, there's still a lot of COVID out there and we don't have herd immunity yet. What fully vaccinated people can do is you can have private visits with other fully vaccinated people indoors. So like single family visits or just small gatherings. You can visit with an unvaccinated person or single household family, as long as no one that's unvaccinated is at high risk for severe disease, because if you were to get them sick by any chance, you don't want them to have complications. And if you're fully vaccinated, you don't have to quarantine and undergo testing after an exposure as long as you don't have symptoms. So again, you are exempt from quarantine, but you are not exempt from testing and isolation if you have symptoms. So I know this gets
Dr. Moore,
really complicated.
Some people are saying they can't see your slides. I saw that come across the chat.
So it's highlighted in a red box. I don't know how else. I don't know why this doesn't work. All right. It's saying I don't have PowerPoint to share, so I can't. Let me escape. Let me go out of my show. I don't know why. The only option I have to share is my screen, my window, and it doesn't give me a choice to share my PowerPoint presentation. So I was trying to share my window. I guess I will upload my PowerPoint file and see if that works. I have never tried that before. I do not know why this has been a problem lately. Okay, so now it's uploaded right into Teams, so hopefully you'll be able to see it now. So I was here, this is just a review of what's on this website, which is the more detailed explanation of what fully vaccinated people can do and what they are still recommended to do. I found out this week that MDHHS did put together a travel handout. It's a two-sided thing, came out the end of February. I have no idea where it is. It's buried on some website somewhere. I don't know. Somebody sent me the link from the state. It doesn't share anything different. It just has the CDC recommendations in it. The back page does have a specific section they have labeled for educational settings, but it does just say that, you know, if you travel, you could bring COVID home with you, that students should consider staying home after travel, that they should get tested. So what they are recommending, I did have a call today and one of the docs from MDHHS is on the call, and they are basically encouraging all travelers to get tested before and after travel. Can we make sure all our phones and computers are muted? Thanks. They will not require travel or quarantine to occur. They just recommend self-quarantine, so individuals can decide if they want to quarantine. There will be no requirement. MDHHS is offering to help schools set up pop-up rapid antigen testing sites for some point, like immediately after or after spring break. I think some talk has been of doing it like at welcome centers or different places. She said they've been in regular communication with the ISDs and have been offering to do this already. I never know because I don't see those emails. So if your ISD has not heard anything about this and you're interested in setting up this kind of testing, you can email the testing support email, or whatever email you have for your sports testing, and ask more information about that. She did mention that it is a pretty labor-intensive and costly endeavor for them to do that, so that if they do come to your area to do testing, try to get as many people from your school and from your community to come as possible to make it a real worthwhile event. And there is more info about school testing at the michigan.gov/school COVID testing website. But again, they are trying to arrange this with any school that's interested. Another thing I've been getting questions on, I've been getting more requests about, can students, especially athletes, test to get out of quarantine earlier? So just a reminder on that, the CDC did give us permission to reduce quarantine to 10 days if you feel comfortable with that individual monitoring and reporting any symptoms if they were to have them within that 14-day period. 14 days is still the gold standard. And if you're concerned, or if we're concerned that somebody might have been exposed to one of the new variants, 14 days is what's going to be required. We will not ever recommend, unless something drastic changes, allowing testing and exit from quarantine at 7 days or shorter, just because even with a negative PCR test, there's still a 4% chance on average that they could go on and transmit COVID to somebody. And if they have a negative antigen test, there's a 5.5% chance that they'll go on and transmit COVID to somebody. With 10 days, there's still, an elevated risk. It's not as bad. Certainly 14 days is the lowest risk, but with 7 days, even with negative testing, there's just an unacceptably high risk. With no testing, there's about a 10% chance they can go on and transmit in those remaining 3 to 7 days that they should have been in quarantine. So again, that is why we're not allowing it. Just as a reminder, we're also getting questions about prom and graduation, and I've brought those to the state several times. They said that they are working on some FAQs to cover that should be out soon. I never hold my breath on those things, but in the meantime, on the FAQ page for the existing epidemic order, they do have this question. What's the gathering capacity and restrictions that apply to weddings, conferences, and other social gatherings? So to me, this would cover prom. For indoor events, they just specifically say weddings, but for indoor gatherings like that, it would be a total of 24 or 25 people. For an outdoor event, it could not exceed 300 people. And if people are going to sit and eat or drink, you can have no more than 6 people seated together in a group, and they must be separated by 6 feet, and those groups cannot intermingle. For graduation, I think this question applies, and this one was added. We had done a lot of asking about things like performances and band and choir. So it's a gathering capacity for school events that are open to the public, like a concert or performing arts. So again, I think this would apply to graduation. So if it's a school-sponsored event open to the public, it would be subject to the same rules for an entertainment or recreational facility. So they must wear masks at all times. There's other rules for eating or drinking, but I wouldn't really expect that at graduation. Indoor events are limited to 300 patrons or spectators. So not counting your graduates or faculty that are participating, and it can't exceed 50% of the fire marshal limit, and that's total occupancy. So outdoor events would be limited to a total of 1,000 people overall, and that would include your participants. And you should avoid intermingling, keep people 6 feet apart, groups of individuals 6 feet apart. So I think those, I know they're not specific, and I know there's some other questions that have come up that are really specific these don't address. Those have been forwarded on, and hopefully their FAQs will address them more. But again, I think these at least give you a bit of a start for those 2 topics. As a reminder, this is available with the other documents for the epidemic order. This is a reminder for outdoor seating enclosures if you were to have an outdoor prom. For tents, if it has a roof, it can't have touching sides, or it's considered indoors. So you can have 4 sides and no roof, or one side, or you could have, I guess, two opposite sides, but that's kind of not really anything. But it does explain what indoors and outdoors means. So review of data. This is going to be tricky here because I have to change my screen. So if you can't see this, it will be sent out, and it's the data from the mystartmap.info website. So this is the best I can do to share it. So the state as a whole, we are seeing cases increasing. We are seeing percent positivity increasing a bit for the Central Michigan District Health Department region. Our average has increased a little bit, and our percent positivity has increased a little bit. Same with District 10, and same with Mid-Michigan District Health Department. So we are definitely seeing some gradual increases, and we're seeing some pockets of outbreaks and some more rapid increase. So let me try to switch back. Oh, buoy. I really don't like Teams. I guess I lost my presentation. Oh, good grief. Now it won't let me display my upload. All right, guys, I'm gonna do the best I can here. I'm just gonna have to show my screen, I guess. I don't know what else to do here. I'm gonna have to work with IT, I guess, and try to figure out why this isn't working. So if you can't see this, I apologize. I don't know what else to do about it, but it is highlighted in red, which to me says it should be broadcasting. This is just the state data from the data and modeling update that is on the state website. So if you're interested in looking at it, if you can't see this, it is on the state website, but we will send this out. So case rates and percent positivity have increased slightly since last week. Hospitalization has increased a bit, and our death rates were down a little bit. So again, those are usually lagging indicators because unfortunately, people get sick and then their deaths are, later than their illness and hospitalization. So hopefully that does not catch up. Here are the trends. You can see it's just barely starting to tick up. This gray bar is basically a bar where we don't really want you to pay attention because this is going to lag. These are the onset dates. So these people will test positive down here, and so these numbers will increase in about a week. It's a little complicated, but everything's starting to curve up. Our hospitalization trends, you can see again, it's starting to fish hook up. These are our variant cases. Michigan is about 20% of all the variant cases in the US. However, we do a lot of testing for them and a lot of hunting for them. So I think we're just doing a good job finding them. As you can see, this week we found a variant in Roscommon County and Gladwin County. There was one found in Midland County. We have 4 in Montcalm County, 8 in Clinton County. So it is creeping upward. There was one of the B1351 variants, which is the South African variant, was detected in Jackson County. So this is getting to be much more of a reality, and we are definitely seeing that it is more contagious, definitely causing some outbreaks and clusters to occur. This is just overall outbreaks in the state. It's usually this pattern where long-term care facilities and schools are the top two. We have seen an increase in school outbreaks of about 22, high school outbreaks increased by 25. So that has been the big jump, and junior high and elementary have both decreased a little bit. So we are seeing definite increases in our high schools with outbreaks. These are the number of students involved in those outbreaks. So some pretty good numbers. For us in the 19 counties that we're talking to right now, we've had one new outbreak. Again, this was actually a couple weeks ago that this started, it just because of the way things are reported, but we had one in a high school in the Central Michigan district, but no other new outbreaks. And then there's 3 ongoing outbreaks, one in an elementary, one in a junior high, and one in administration. So a little bit of an outbreak. We went from 2 that were just ongoing to 3 ongoing and 1 new. Testing turnaround time is quite stable from the last time we talked. So that is good, not limiting things. And then this is the last slide. I added in this red line just so you could kind of see things. This again is just interesting. This top one shows the % of the population that's staying at home. And really it's back, this bottom one here is January 2019. We're pretty much back to where we were pre-pandemic. This is back January, January 2020. This would have been January 2020 as well. So not a whole lot of people are staying home anymore. And then this is the number of trips taken by car. This bottom line is 2021. The top one is 2019. So we're pretty much taking the same number of trips as we were before the pandemic started. So, and it continues to increase. So we just have concern about that. All right. So I apologize again for the technical difficulties. And I will open it up. I will scroll down here and find comments. So the first one is, we just want to confirm the recommendations for the health department regarding banquets at school. For example, our band wants to have a banquet where they would all be eating, and it would involve several households, including the parents of students. And another example would be an end of year sports banquet. So I personally would not recommend that. I think groups of people together eating is the biggest risk you have. There's actually a study that just came out showing that areas with restaurants open have increases in cases. I certainly will welcome any opinion of health officers or environmental health people on the call from the health departments, but I would not feel that that is a safe thing to do in the school, especially right now as cases are increasing and the variants are really ramping up. Does anyone else want to comment from the health department? I know everyone's really swamped today.
Well, this is Marcus Cheatham at Mid-Michigan. I mean, I just totally concur, Dr. Morris. If we can just hang on for 3 or 4 more months till we get, our seniors still are not vaccinated. They're still vulnerable to dying of this disease. We must not spread it to them.
And it is possible, they may be able to get together in the summer and have a picnic. Our case rates and may be lower and our vaccination rates may be higher enough, and then to do something in a large pavilion in a outdoor setting may be an alternative. Again, you want to do it right after your season ends or while school's in session, but that might be a concession, is just to wait and see what things are like and then be able to do it in a larger open air area. But to get everybody together in a building and eating in a closed air environment, I would say would be one of the higher risk things that they could do, and I would not feel comfortable with it. Would you be able to do pop-up testing for students? And that's what NDHHS is suggesting, would be a pop-up testing for everybody from the school. So teachers, staff, students, families, everybody. So again, they've supposedly been emailing these offers and suggestions to your ISD. So follow up with your ISD, and if your ISD isn't aware of this, they can email those email addresses, and those are available in the testing documents from the sports testing and it's the same people. If a student has received both COVID vaccines, would they still need to quarantine after a close contact? So if you do happen to have a student who, let's say they're over 18 and they got vaccinated because they're a caregiver to somebody, if they're more than 2 weeks out from their vaccine, they would not have to quarantine either. We're not vaccinating, well, again, if they were to get Pfizer and they were over 16 and got vaccinated, we're just not seeing a lot of young people vaccinated yet. But you're correct. If anyone who's fully vaccinated per that definition does not have to quarantine. And we've gotten some questions about, if it's a household contact that they're exposed to, that still applies, whether it's like a casual work contact or a household contact, they do not have to quarantine if they're fully vaccinated. And the exposure has to occur when they're fully vaccinated. So if you got exposed on day 10 past your vaccine, you would still need to quarantine because you need to be fully vaccinated, which is 2 weeks past your final dose when you are exposed, because basically we want you to have your proof of full immunity when you are exposed. So hopefully that makes sense. What if we have staff that is serving high-risk students? Per new guidelines for the fully vaccinated, I consider that they wouldn't need to quarantine if considered close contacts to a COVID positive person and are not displaying COVID symptoms. Does it make a difference if those we serve are high risk? So there is no specification that says, only if serving low risk people or if not around high risk people. However, it says you can be exempted from quarantine. If there are concerns, if you have a staff member that's fully vaccinated, but they were exposed to a variant, or they've just traveled, or that they have a poor immune system, so you worry their vaccine might not work, they can still quarantine. We also had a call recently on someone who did not feel comfortable not quarantining. Well, you can still quarantine. It's just you have the option of not quarantining. So again, you can continue to quarantine people if you would like. It just depends, it's helpful for your work coverage, your staffing, things like that. So again, if you have a situation where it just is not seeming to be a safe decision, you don't have to do that. It's something you can do. What happens for someone who is fully vaccinated after the 90-day window ends? Do they have to get another vaccine? So previously there was a 3-month disclaimer on that. Now there is not. It's kind of open. And so as time goes on, if the CDC or the manufacturers of the vaccines are seeing that the immunity is wearing off, those recommendations will be changed. But right now, there's no end date to that. Again, if we get to 2 or 3 months and they're seeing a lot of people getting infected who've been vaccinated, those guidelines will change. So, so for now, don't worry about it. And we'll let you know if anything changes. And I'm sure, the media will let you know as well. Do you have any idea when students with special health needs will be eligible for vaccination? I don't. Basically, once we whittle through enough of this current group and we start getting where, we don't have a long waiting list, then we'll open up to the next group, which should be people with health conditions, whether or not it'll be everybody over 16 or if we have to start with certain ages just because we get too much of a flood, it will be determined. So we're working as much as we can to get there. As an ISD superintendent, I have not received any email notices yet. I do believe this topic is on our statewide. Okay. Yeah, so make sure when you talk to the state tomorrow, they bring it up. That's why I wanted to make sure to mention it, because you might be guaranteed something is happening, but you never know if it's really happening or not. So make sure and follow up with them by email if they don't bring it up. Our teachers and staff are participating in the rapid testing program. If they are fully vaccinated, should they continue in this weekly testing program? You can ask the state about that, but honestly, that's a good question. You might want to ask the state about that, because part of their reason for doing it is for surveillance and kind of data finding. I would ask them if they want you to continue to participate. We have had a few, and they're not school related, but a few cases already that have occurred in people who have been fully vaccinated. They have had health issues that have explained that, but I don't know if they might want to keep monitoring people just to see if there's any signs of breakthrough infection. And as you know, if you're positive, they would confirm it with PCR testing. So, they wouldn't just assume with the antigen test. We are hearing that basketball teams only have to quarantine for 9 days if exposed. Is that true? No, it's not. And if someone's telling you that within one of my districts, let me know. And if it's not within one of my districts, let me know, and I'll let that health department know. So quarantine rules are the same for everyone. And we have been seeing activity within sports teams. And so we really don't want to cut corners, because we really don't want to see those outbreaks occurring. So yeah, that's an unfortunate rumor. Are there any other questions that anyone has?
Dr. Morris, Kara Hotchkiss has her hand up. So Kara, if you want to hop on.
Sorry, that was unintentional. My apologies.
Okay.
No problem. Any other questions? All right. Well, I'll send out the slides and the data, and I'll also send out the link to that 2-page travel handout from the state, because it is, again, I don't have any idea where it is on the website. One of the docs from the state sent me the link. And
there
we'll
is a
continue to
question
try to get.
there,
Yeah. Sorry. No problem.
One more question added.
So if staff are fully vaccinated and travel over spring break, should we still encourage them to attend the pop-up testing before returning to school? Yes, you should. So with travel, again, because we're seeing these different variants, the recommendations for testing and quarantine are the same. Again, the quarantine is kind of a self-imposed recommendation. But yes, testing would still be recommended even if you're fully vaccinated, just because we are worried about these different strains. The concerning thing about that South African strain that they identified in Jackson, and then also the Brazilian strain that we don't yet have in Michigan, is they may not respond as well to some vaccines. And so with travel, you have more chance of coming in contact with these other variants that aren't that prevalent in Michigan yet. So ideally, we'd all stay put, but I know we're all getting cabin fever, so it's difficult. All right. And what I was going to say is we'll keep keep trying to get clarification on the graduation and prom questions I've gotten. And get those to you. Hopefully I'll have specifics very soon. And hopefully, I'm hoping that they'll be shared directly to you because you guys are the ones that need the answer. But if not, we'll make sure you get them. All right, last call for questions. Okay, just remember cases are starting to increase and we are starting to see outbreaks, starting to see, you know, it's getting warm out and rules have changed. And so we're kind of slipping away from our mitigation measures. So as much as you can, help people remember we're not out of the woods yet. We appreciate your hard work, guys. We'll see you next week.